Hi, and welcome to a review on Chapter 17, Pathology and Laboratory. In your instructional notes, I think you have found that they're all located at the beginning of the Pathology and Laboratory section. Path and Lab subsections include additional instruction notes. Some of the subsection information that you may find include definition of tests within that section. It could include types of specimens that the tests are run on, like blood, serum, urine, or other body fluids, a brief explanation as to the type of test that is included, and which analytic services are included in a certain test. Your Path and Lab sections are as follows. They're all broken down from biophysical all the way down to pathological and serological. And your subsections start with chemistry. Well, they don't start with chemistry, but they go chemistry and hematology, molecular diagnostics, transfusion medicine, microbiology, and anatomic pathology. More include cytopathology, cytogenetic studies, surgical pathology, transcutaneous procedures, other procedures, reproductive medicine procedures. Okay, they're further broken down by organ and disease-oriented panels, drug testing, therapeutic drug assays, suppression testing, consults, urinalysis. Have a clear understanding of what all the terminology is on the previous slides that we just blew through. What is the difference between hematology, microbiology, and surgical pathology? You need to understand all that when you may be ordering tests or coding for them. What is the difference between qualitative and quantitative? Qualitative simply means that there is a presence of something there. Quantitative finds out how much of that is present. Your section layout is organized according to procedures performed. Your procedures are listed alphabetically within each subsection. Make sure that you review all appropriate documentation, code descriptions, and instructional notes within the particular section. What you really need to know. Labs done while a patient is an inpatient in the hospital are hard-coded in the hospital charge description master. So for purposes of what we're learning right now, we're focused on the outpatient labs that are done in a physician's office or an urgent care or other outpatient setting. These are usually routine testing that the results can be immediately resulted so that the physician can treat whatever they find. These could include urines, strep tests, pregnancy tests, mono tests, and glucose testing. This is not an all-inclusive list, though. What you need to know about CLIA. CLIA is the Clinical Laboratory Improvement Act of 1988. Physician office labs must obtain certification to perform some of these pathology and lab tests and in order to submit claims to Medicare and Medicaid. When you're submitting claims to Medicare and Medicaid and other third-party payers, you want to use a QW modifier in addition to the code for the lab test. Your CLIA Waived test you can find at the cdc.gov website, and here's a link to that resource. And as defined by CLIA, waived tests are simple tests with a low risk for an incorrect result. Only remember that it doesn't mean that they're completely error-proof. There is a complete listing of 55 pages of CLIA waived tests if you go to that link. Provider-performed microscopies are all of these listed here. And these are also on that link that you previously saw. In conclusion, study the key terms at the beginning of the chapter. The notes and coding tips within the chapter in your textbook have very useful tips. All the CPT codebook subsections are covered in detail in your textbook. It is very useful information for you to learn. And that's about it. That's all, folks. Is this really the end? Well, almost. Or is it just the beginning? Happy coding!